Hello. Today I'm joined by Sterling Peloso, who is well known in our industry and has quite a pedigree. He is currently the president of Avante Patient Monitoring and Ultrasound, that part of their business, the Avante Group. Sterling, welcome to Healthcare Business News.
Thanks for having me.
So, Sterling, how are things in California? What's it like there?
Well, it's interesting. We've had stay-at-home orders for the last 30 days, I believe. Still gives you access to to supermarkets, or if you want to pick up food curbside, but schools have been closed. They just reopened beaches, super important in Southern California. It's been it's been a bit of a grind. I will tell you, it's been tough.
And tell me, I know that it was a group of companies that came together. In the patient monitoring and ultrasound business, your group must be in a position to make a contribution. Can you tell me about that?
Yeah, this really all started about 4 weeks ago, and I would say mostly on the patient monitoring side. We noticed with New York specifically that we had a number of hospitals that were requesting pumps and as well as monitors for their new COVID areas that they were developing for overflow patients. And so we were really able to deliver on quantities and the need there, and really became a rallying cry for our organization, to be honest with you, that this was a little bit bigger than, much bigger than a sale or something like that. We were really helping to save people's lives by making sure we had equipment for them to use. So, and that happened throughout New York and part of Washington and other parts of the country that really had an influx of related.
So that has to make you feel really good. I visited the facility, I think in Ontario, right, where the monitoring group is. How did you handle social distancing within the organization there, where all those people are working closely together to repair and test equipment?
Yeah, was really driven throughout the Avante, all the locations throughout the U.S. That's in ours as well. As we did create work areas that were distanced appropriately. We were able to obtain N95 masks or other masks in general for our employees to keep them safe. We are an essential business, so that was our main focus, is making sure for those patients that are in the real hotspots of the country that we kept our employees safe first, because we owed it to them to make sure that they could get their equipment and get their repairs done. So.
Okay, well that's great. And has there been any logistics problems, supply chain problems, anything that you've had to overcome?
I think initially there were some hiccups with some of our suppliers, but in terms of if we needed parts or some of those things, but I think those have worked through the system. There was heavy demand on quite a few items from the OEMs and others that we were able to work through, but I think we're in a great spot now. But I think that was inherent throughout our industry. So.
Tell me, do you think the healthcare delivery will change in the years to come as a result of this?
I do think short term that will be the case. To predict how it will be in the future, I think we will probably fall back into some of our ways. I know for a fact that when the next event like this comes forth, that we'll be better prepared. I think that was part of the issue. Is I don't think anybody saw this in their crystal ball, but I think we are much prepared for the future, past kind of events that have happened in this country and around the world. So,
right. What about, you know, we always, people always say there's some benefit. Is there any, are there any positive takeaways that you have after this experience?
well, I think from a interesting from a family perspective, having kids and families together, you really, I think people have been able to kind of reconnect with their families. I think that's been a positive. I think from an organizational standpoint, the kind of teamwork that's developed from this event and the sense of purpose that we sometimes I think, lose sight of as companies and in any industry, I think has been life-changing for us as a patient monitoring group and an ultrasound group. And I think those are positives, and hopefully that will continue as we move forward.
What about internationally? Do you do much? Does Avante do much in the way of international business?
We do. We have an international group specifically that's focused on those areas, and they were very early on in helping to supply countries that were most hard hit earliest with critical medical equipment. Us as a whole, from a patient monitoring ultrasound side, it's been less so. That's most of all of our help and products and services have all been missed.
Okay. Any advice you want to offer to any other companies that you think will be helpful?
I would just, I think that I think we get caught up in this, that it's forever. It seems like, I will tell you, it seems like we're in one long day. It seems like this, the same thing every day, and the kind of us being stuck in our homes or limited definitely in what we can do, and that it will end soon enough. And we will need to adjust though in this time, and make sure you're adjusting and taking care of employees and taking care of your families. But I always see it as, I think there is light at the end of the tunnel, and it didn't seem so a few weeks ago.
Well, I want to thank you for spending time with me, Sterling. I know you're serious in this interview, but I know that you're a very fun-loving guy and always fun to be with. And I look forward to spending some time with you again when we can have some jokes.
Please come out and see us. We'd love to see you again.
All right. Thank you so much.